Hi, this is Gail Romero. I'm Public Exposure, sitting in for Stan Emmerich this evening with our guest, Dr. Craig Rubens from Children's Hospital in Seattle, Washington. And we're here today to talk about GAPS. So, Dr. Rubens, what's GAPS about?
Well, thanks for asking, Gail, and it's great to be here and get a chance to talk about what we're doing. GAPS is the Global Alliance to Prevent Prematurity and Stillbirth, and it's an initiative of Seattle Children's that's really fairly new, started in 2007. And our mission is to catalyze and accelerate the research needed to really begin to prevent these devastating health problems of babies born too soon or babies who die before they're delivered.
So, Craig, tell me a little bit about yourself. How did you get involved in this, and what drove you to this? Because I think you come from infectious disease and disease control, and now we're talking about premature birth and stillborns. So how did that transpire?
So my background is as a pediatrician and as a scientist very interested in infectious disease. And my job at Seattle Children's for the last almost 30 years has been to take care of children with complex infectious disease problems, including babies who are born too soon. And my research interest grew out of our observations that babies that were premature had problems with being at risk for severe infections. And in studying the kinds of infections they had and how bacteria and other germs cause infections in these babies, we began to realize that some of these babies are born too soon because the mothers get infected. And the babies get infected at the same time, and it precipitates a preterm birth. So in studying this, we began to see a very strong link between infectious diseases and in prematurity, and also began to recognize that infections cause some babies to actually die before they're delivered.
Okay, so we're going to see a video now here in just a minute, and I'd like you to set it up for me if you can. It's about 4 minutes, but it's pretty heady stuff when you consider who you were presenting it to. Can you tell me a little bit about that?
Sure. Well, this video is really a composite of some interviews or presentations that were done with collaborators for those investigators that worked with us on a project that the Bill and Melinda Gates Foundation funded to look at what we knew and what we didn't know about premature babies, preterm birth, and stillborns. And the idea was to really understand what we knew, what we didn't know, and what was needed in the future to stop this from happening. And so the video shows some investigators we've worked with over the last 3 or 4 years, some outstanding, very talented individuals, and also the product of that report, which was actually presented in Washington, D.C. this a year ago, February, to actually showcase what came out of this report and to begin to educate people about what was necessary.
Okay, well, I think we're just about ready to show that video now. And so we'll look at that and then get some comments afterwards.
Great.
I believe that through medical research and collaboration in the form of GAPS, we can see the end of this global crisis of preterm birth and stillbirth.
One of the reasons that newborn deaths haven't been on the agenda for so long is society doesn't value the death of a newborn in the same way as the death of an adult. So if you think about it, there are maybe 3 million deaths due to HIV each year, and every day we hear what a big problem that is. And yet it's very rare that we hear about stillbirths as a problem, or that we hear about neonatal deaths due to preterm birth.
The only chance these babies have is if we provide, if we improve the quality of healthcare. What moves this group of scientists to work together and trying to find solutions?
I think we have a major health problem that is not getting the attention it deserves.
Women really struggle with how to cope with the grief surrounding stillbirth, and I think culturally, in a lot of places, it's viewed as the woman's fault. It's viewed as something that she did. We heard stories from women about very complicated cleansing rituals that they had to go through after a stillbirth in order to be acceptable for their husband. There's such a lack of attention on preterm stillbirth vis-a-vis these other important areas in global health, and yet the numbers show that this is just such a significant disease burden for women and children.
These issues have been around a long time. And unfortunately, I think they've been ignored from the greater agenda of public health and health services for maternal and newborn and child health, which have been underserved areas anyway, for a variety of both political and resource reasons.
The strongest impact that you can get from implementing evidence-based practices from partnerships, particularly partnerships between scientists in the developed and developing world, where you bring some of the best science that's out there to where the problems are.
I think that we can look at prematurity and stillbirth now. I think should be looked at with the same enthusiasm and vigor that in past years people have looked at stroke and heart disease or even cancer. Certainly the economic burden of prematurity is enormous, estimated to be at direct costs of $26 billion a year in the United States alone.
Probably half of those 1 million deaths due to preterm birth could be saved with very simple, low-tech care.
You know, we lose 10 infants a minute in this world to both prematurity and stillbirth. So it's really critical that we don't waste time so that we're saving lives and improving lives.
That was some amazing information, and I'm sure that the Gates Foundation was absolutely tickled to have GAPS do this work for them and to come in with this information. So I know you've worked with the Bill and Melinda Gates Foundation and you've worked with PATH, but you've also worked with the World Affairs Council, or at least they've supported you in getting out and doing public presentations and things. Tell me how those alliances work.
So one of the great things about starting a new initiative in this community is the incredible presence of global health, not only as a sector that's really interested in just the health and well-being of everyone in this community, but beyond and in our international countries. But one of the fascinating things is this is a place that's really about innovation. So to start something which needs a lot of emphasis and effort, in which we found big gaps in our knowledge and in the science that could help us improve the lives of women and children, working in a community like this where there are organizations like PATH, Seattle Biomedical Research Institute, the Gates Foundation, World Affairs Council, it goes on and on. There's a huge list, all under the umbrella, in particular with the Washington Global Health Alliance, which has brought us all together. It makes it a lot easier to get a new initiative started. And it gave us the opportunity to partner with really innovative thinkers and big thinkers who are on the cutting edge of new frontiers that could really lead to new ways that we could actually think about how we could improve the lives of women and babies and children around the world.